Thank you everyone for joining the session. We have a very esteemed set of panelists with us and look forward to have a very engaging conversation with all of them. Let me first introduce Dr. Nadine Hashasharam. She's a clinician, lecturer, and entrepreneur. She's an NHS surgeon and recipient of the British Empire Medal. She's also founder of Proximi, which is a digital healthcare platform that allows clinicians to virtually scrub into theatre from anywhere across the world and allows them to really interact and collaborate with the team on the ground and really pushing the boundaries on how to make a borderless hospital. We have Vishal Bali, who's the executive chairman of Asia Healthcare Holdings and a senior advisor to TPG Growth. Vishal is a veteran in healthcare industry. He has led multiple organizations in healthcare, both in India and globally. As part of Asia Healthcare Holdings, he's creating one of the largest single specialty platform on oncology and mother and child. And we have Harsimarveer Singh, who I call Harsh. Harsh is a serial entrepreneur. He's actually founded multiple startups in tech and analytics. He's currently co-founder of Pristine Care, which is potentially one of the fastest unicorn in healthcare space in India. And Pristine Care is disrupting the way surgeries are delivered to Indians across the country. It's a pleasure to have all of you and look forward to have an engaging conversation. Now, at least to get the ball rolling, I'll share some thoughts and love to get your reactions as we build on this. I think all of us has seen COVID play a very, very pivotal role in how healthcare is delivered. I think healthcare not only become a very important topic, but COVID was also instrumental in bringing digital and technology at the forefront of healthcare. I think in last 2 years, we have seen almost $60 billion of investments going in digital health globally. Having said that, we've also seen that there are also a lot of learning which have come along with it. We have seen the adoption of telemedicine go up and down as the waves went up and down. We've also learned that digital is not the only way. We do need a physical form of healthcare delivery as well, and it will always be a phygital, and neither physical or digital can sustain on its own. We've also seen that sustainability of the model is very important. While they address the core pain points of doctors and patients, it's important to create a sustainable model. And I think more interestingly, I think what we've also seen is there is a lot of integration happening across the care. Different parts of healthcare which was siloed historically are getting together into ecosystems. And we're seeing innovations coming up from the West, but also from the East, from this part of the world, almost at equal pace. And a lot of innovations are actually traveling globally, much faster than anyone of us would have imagined, given healthcare systems are very, very different across the world. In that setting, I would maybe love to pick up, Vishal, first your brains on how have you seen healthcare evolve over the last couple of years from your vantage point of view?
Yeah, so good to be on the panel, Chirag, and glad to be here with another conversation. If you take a look at how the models of healthcare have evolved, you can have two distinct time periods: the pre-pandemic and the post-pandemic. And I think the post-pandemic is still evolving. We will still see some changes coming through. The massive digital pace that we all thought the consumer had pivoted completely to is actually proving many of us wrong, that it is not so true, particularly on the, it depends on for what, right? And so like, for example, on the hospital care perspective, and we thought that a lot of outpatient work in hospitals will completely shift towards digital, particularly for the second and the third consultations, and the first ones will probably be physical. A lot of our hypothesis is going wrong there in terms of the consumer still wants to come back physically, which is not a great situation for telemedicine. But I think that will evolve over a period of time. So if you basically split that time and between, where healthcare delivery first started, which is now, in this country, almost about 35, 40 years old, and to where we are. And if you sort of look at time periods of decades each, I think the previous decade has been the most interesting because it has sort of thrown up multiple new models of healthcare. It has also given us very different kind of assumptions. All of us who are running large healthcare systems, we all felt that 300 beds, 400 beds is the game to be played because economies of scale, economies of growth, consumer retention, everything was happening on the back of the scale of beds that we could create, right? And unfortunately, I think the thinking all along has been that the hospital is the center of care and everything revolves around that. because you get your clinicians there, you get your nurses there, and you get everything else there. That hypothesis got broken on the back of the fact that suddenly we found that our return on capital employed for many of these larger institutions were actually getting hammered over a period of time because we were putting too much capital to work for very little return. So to your point on sustainability, I think there was a big learning point over there that, ROCEs and healthcare, until and unless you really see and be very thoughtful in terms of what your initial investment is, looking at that over a period of time, ROCEs will just get better and better because every year your consumer footfalls, your growth rates are all going to be great. That assumption itself is wrong, right? Because there is a certain momentum to healthcare delivery and growth, whether it is, and the diagnostic guys are also seeing it pre-pandemic and the post-pandemic. So I think what we've learned over a period of time is one, that you need to offer different models of healthcare. You need to experiment with, lower number of beds. And, to that model, even Harsh and team, what they are doing in terms of what they're doing with Pristine is a very innovative thought process in terms of the capacity that is sitting there. More importantly, experimenting with this entire single specialty approach that we've sort of taken also was a part of that learning. That how much capital you put behind a large multi-specialty hospital, simultaneously how much capital you can put behind single specialty institutions, how do your return metrics pan out? If your return metrics are certainly good, you just continue to build single specialty institutions while you also have multi-specialty hospital networks, which should probably potentially be about 200, 225 beds, right? You get to the right economics on the back of the bed capacity that we create. And I think then the conversion point of all of this in terms of newer models of healthcare, which again happened in a pre-pandemic, but the pandemic actually just accelerated that a lot more. Concepts like home healthcare and home becoming the destination of care. I think a lot of this got tested over the last couple, I would say over the last half a decade, which unfortunately also had the pandemic as a part of it. So I think we're in a good place today, Chirag, in terms of all the learnings that have happened. And the convergence of digital and physical healthcare, a lot of learning over here, which I think over the next half a decade will be very, very useful.
No, very well captured, Vishal, and I could not agree more on the whole pushing the boundaries on disruption. And I may be harsh on that point, that I think Pristine has really pushed the boundaries on how the ROCEs and how the bed sizes should be, or even there should be a physical hospital, many of them. Love to get your thoughts and how you're looking at it. Harsh, on mute.
Sorry about that. I think Vishal actually captured a lot of the, lot of the thought process around the way business and the way infrastructure has been looked at it. Maybe I can cover the other side on from the physician and the maybe the patient side of what has evolved in the last maybe 3 to 4 years and how we look at the future. Maybe that'll add more context. I think what has happened, and I can also cover the Pristine context here in terms of how we look at infrastructure and new models of healthcare, which is the reason we exist. But coming back to the expectation side, I think what has really changed, especially in the last 2-3 years, is the way a patient looks at healthcare ecosystem. The expectations from physicians, from doctors, from their care facilities. I think those expectations have changed a lot. While Vishal is right that maybe we ran towards digital adoption, maybe teleconsult, and everybody felt that maybe the patients would only want to do digital interaction, then that has changed since the pandemic and people have started to come back. But what we cannot mistake is that it has left a permanent footprint. To give you an example, today, even before the pandemic, and we do surgeries, we don't even do a lot of primary care. So we have very secondary care. A patient who comes to us has been suffering from a disease for 3 to 4 years, is looking for a surgical treatment. So very niche. But even then, 30% of all patients who come to Pristine, come via online consult. They interact with a physician digitally. They submit their reports digitally. They have already been diagnosed, so they have a lot of references on that, and then they come and meet the doctor. This was not there before the pandemic at all. Yeah, and that's a change in mindset. Similarly, on doctors, I remember when we started Pristine in 2018, and we came from a very tech-driven background, and we started building our EMR and doctor's app where every information for the patient would be captured. It was massive challenge for a doctor to even adopt anything beyond a WhatsApp. To just convince them on using an app and convince them on using an EMR or digital mediums is very hard. But post pandemic, some of those things have become super easy. Today, about 92% of all patients who come to Pristine, they have an EMR where doctor fills the prescriptions on an app, which are pushed to the patients digitally. And that change of mindset, COVID has helped us, quicken that up. Even hospitals. And hospitals have started to look at technology differently. The way Pristine functions, we have our own clinics, we have our own surgeons, but we use somebody else's hospital to go and do the surgery. And the entire thesis of our existence is that we will improve patient care. And to do that, we want to reduce, let's say, the time a patient gets admitted to the hospital, which can be anywhere between 2 to 3 hours. We want to bring it down to 30 minutes. How do you do that? A big part of that is if we can do a lot of patient paperwork, even before the patient reaches the hospital, where the patient is doing digital consents, where a patient's KYC is shared with the hospital, where OT availability and OT planning is not done right at the last moment, right? Before the pandemic, all this was not very easy. Post the pandemic, we have our own white label labs inside the hospitals, and a lot of information has started to be shared there. So I think there's a change in mindset, in the hospitals as well. Even I'll pick up a small niche here, which I think both Vishal and Dr. Nadeen will clearly identify with, is insurance. One of the largest aspects of healthcare, which has been growing massively, is the adoption of patients buying health insurance. But the health insurance claim processing, even today by any standards, is archaic. Think about it. When a hospital submits a claim to an insurance company, there is a human sitting down and going through a bunch of questions and answers to decide how much to pay to this patient. I mean, we are in the age where AI is predicting breast cancers better than a physician. And why should somebody be sitting and deciding, should we pay somebody a 70,000 or 71,000? I mean, you can do rounding errors there. So I think that there needs to be a massive improvement on that. So I think there's a change in mindset. I also believe, my own background is very tech driven, so there is an affinity which is more. When you were introducing Dr. Nadeen, I am so excited that the future holds where a doctor in the US will be training an upcoming surgeon in Africa or India via metaverse, and I think that's a reality which is not going to be too far in the future. Even today at Pristine, we are training and upskilling surgeons on modern treatment technologies, where a doctor is operating on a real-time patient in a distant place, and everybody is plugged in through a video call, and a doctor is able to go deeply in the training. So I think borderless OT is a real thing, and I think it goes as far. I'll tell you something else, Chirag, and maybe take a minute extra. I think what also is going to change is there's going to be a lot of preventive health which is going to come in. Mm-hmm. One of them, my wife is a doctor, my father is a doctor, I have the entire family of doctors, and you're of course aware of that. One of the challenges every doctor says is that a patient, or used to say, is that a patient who comes looking at five questions on a Google is self-diagnosing, and that's not great. But I'm telling you, in the next few years, it's going to change. The doctors are going to hope that the patient goes through an AI algorithm where his bunch of questions are captured, and when he reaches the doctor already has his history, his background, his family issues, and already knows a lot about the patient and helps to do a better first consult than today. And it's all going to change.
Well, it's very fascinating, I think, that you talk about it, right? Because even the earlier panel I was listening to, I think personalization of healthcare is clearly the way forward, and I think tech can play a big role. To not, and it's not to a threat to clinicians, but to just empower them, enable them to be even more targeted and help them get more efficiency. On that note, Dr. Nadeen, I think you come from NHS, you come from the Western background. Love to you to contrast what you're seeing over there? I've had the privilege of working in NHS. It's a different system, but a lot of pain points are very similar. Love to get your thoughts on it.
Yeah, I mean, first of all, it's great to be on the panel. Thank you so much for allowing me to join this. It's great to sort of share and hear from the other panelists, their perspectives. And I would agree first and foremost that these challenges are not challenges somewhere, they're challenges everywhere. And what we're describing are just dressed differently, but even within the NHS and even within the US health system, these are similar challenges. Now, undoubtedly, what we have seen is that the complexities posed by COVID were unprecedented. And whilst incredibly tragic, they have accelerated behavior change to more comfort around digitization, around adoption of new technologies where these can augment or help scale, whether it's diagnostics, care delivery, or even training, as we're seeing with Proximie, or the delivery of care within operating rooms. And so what it's enabling us to do is to move beyond this bricks and mortar concept of healthcare and think more laterally about pushing that cultural resistance against digitization, which was historically there, to really move towards a health systems that are, beyond the four walls of a hospital or of a clinic. How do we really deliver a more patient-centered, comprehensive level of care that is about collective willingness to want to drive important changes in healthcare swiftly and efficiently by being open to different perspectives, different ideas, different business agendas for a greater good? Of course, we see this in surgery at a global level. The urgent need for surgical care systems is strengthening. We have never, the amount of mortality from surgery and in maternal health is at a record high. And so we really need to look at how these solutions like Proximie are going to continue to be able to play a role. And we are seeing this on the hospital side with my clinical hat on. We are seeing this as a challenge around what's going on with waiting lists, what's going on with time to treatment with cancer. How are we looking at these inequities and discrepancies in healthcare becoming worse and worse? The other bit, I think, which is key that COVID obviously shone a light on, but is a problem we already knew existed around the world, is variation. Variation care, high-end hospitals versus rural ones, one-bed hospitals to multi-bed hospitals. And this is where we're recognizing that this is a global challenge again. And how do we codify and strategize against pulling that sort of holistically? And one of the big ways is around transparency and data. And the other is being more comfortable with digital technologies that are cloud-based and that span beyond a particular geography. And so what we're really excited about, both at Proximie and at a hospital perspective, is that our solution and our concept around a digital operating room, a connected data-driven operating room, is now coming to the fore, because these are the tools that are going to enable us to really scale expertise where it's needed.
Absolutely. I think data and transparency can play a big role. And I think there's also a point on, think of the journeys. And Vishal, I think you've been one of the pioneers in single specialty. And I'm thinking about, I think mother and child is a very happy experience where patients are looking for something else. And cancer, on the other hand, is a very, very, very different experience where you're really looking for a very different level of care. How are you thinking about it, and how is technology helping address some of the pain points across the patient journey on both of the models?
So, Chirag, firstly, I'm a big fan of technology, right? So let it not look like that I do not believe in that. I think technology is one of the biggest enablers for healthcare moving forward, and we have to do everything possible to make sure that we continue to push and accelerate technology adoption, digital adoption in healthcare. So that's a no-brainer to my mind today. When you look at different streams of specialties and how in those different streams of specialties, one is using technologies to sort of create better quality of experience of the patient experience between first the clinician and the clinical surrounding, and second, between the patient and the institution, right? So I think we are seeing a very different set of consumer relationship management programs now than we ever did in healthcare. And I think there is a lot that healthcare is today learning. So whether it is a very clinically intensive treatment in cancer, or as you rightly said, a clinical treatment in mother and child, which is all a very happy experience. But then there is this entire neonatology side of it, which is not really the most happiest of events, because that causes a lot more post-maternal pain, particularly when babies have to go through neonatology care for long periods of time. Part of our business also is in the world of IVF, which again is clinically intense, but again, a very staged kind of consumer experience, right? Because it happens over a period of time. So I think there are different forces at work over here, Chirag, in terms of how the consumers are looking to interact with their healthcare providers in all these multiple specialty streams. So particularly like, for example, in oncology, one of the things that one was the model itself. And the model was there was a time when people never really invested behind oncology setups in this country and even worldwide, even when I ran businesses in different parts of the world, because oncology is one of the most capital intensive specialties that you can ever have inside healthcare enterprises. But given the large spectrum issues that we are now seeing globally around cancer detection, I think a lot of consumer groups are now actually wanting a better quality of experience in their cancer treatment itself. How do you make it more consumer friendly? And that is not just in terms of different spectrum of cancer treatment. So whether it is, I think between medical oncology and radiation oncology, most of cancer in both these areas has now become daycare, right? You never really now admit patients for any of these modalities. In chemotherapy, particularly with the onset of immunotherapy and a couple of other therapies, a lot is changing in terms of the therapeutics and the consumer interaction with those therapeutics, right? So I think what is left in that space now is also surgical oncology, which obviously is multimodal, multi-organ. And even in that, we are now trying to see as to how we can create multifunctional teams, which never used to happen in oncology earlier, where you are talking to your radiation oncologist, the medical oncologist, and the surgical oncologist at the same time. This was a specialty where you go to a medical oncologist first, and he would actually tell you to do chemotherapy. You go to a surgical oncologist, and he will actually cut you open. And the radiation guy in between will turn on and say, let's try this. But I think trying to bring these three forces together to actually create one mode of treatment is a big push in consumer alignment. And I basically feel that's been our big distinction with the way that we created behind American Oncology Institute, the cancer network that we created. Even on the mother and child side, we are now picking up a lot of learnings from the hospitality world around consumer interaction. And this is not just about giving them nice breakfast and dinners and everything else, but how do you actually bring that interface point by using apps, by being a part of the journey of motherhood for these patients or for these women who are going through the journey of parenthood, and how can you make it even more pleasant? How can you keep on alerting them in terms of the next test that they need to go for? So how do you make them feel more empowered, which is all on these digital platforms now? And I think that's really creating a much better level of experience for mothers who are going down that path. I'm actually now implementing something even on the IVF side where, consumers are having a very different interaction point with our company, Nova IVF, than what they ever did. They know exactly what their next line of treatment is going to be at different intervals of time. So patient expectations are changing a lot. Consumer interface with healthcare is changing a lot. I think clinician behavior change, which has been one of the toughest points to and the hurdles to cross, is also getting pushed a lot more today because of a more empowered consumer. So clinicians are now beginning to think from a consumer hat, which they never used to, because they were always more worried about their clinical side of things rather than the consumer interaction. And I think that's a massive behavioral change which is beginning to hit healthcare very powerfully and very positively. And that needs to continue to happen.
Absolutely. I think you touched on, I think Harshad also mentioned earlier, I think getting the clinicians to also change and adopt technology, right? It was never easy. And Harsh, you are working with a lot of young clinicians, right? Young aspirational clinicians. And at the same time, you're also working with very, say, old founders of owners of nursing homes and hospitals, right? So two questions for you. One, how do you see this whole adoption of tech, and what are you doing to take the inefficiency out of the hospital? And second, just out of curiosity, how much of bandwidth goes in tech versus solving clinical, right? I mean, you're a classic combination of both of them.
Vishal talked about physicians changing guard. I think healthcare is finally, as an industry, moving towards consumer, or in our case, patient first. It was actually, very honestly, it was never patient first. It was always doctor first. And the simplest example to that is, I would ask a doctor that, hey, your OPD timing says 10:30, but your receptionist calls you at 10:35 when the patient lands up, and you are saying, I'm coming in 15 minutes. Why is that? They said, hey, I'm a doctor and this is all right. But I think now it's changing. You see the doctors, and that's the simplest one. They will be on time. They will come before the patient, and they're okay to sit down in the clinics or the OPDs when the patient is not there. I think so. There is a very, very positive. There's a very positive change in at least the outlook. In terms of the question, so we have a team of 200 engineers, working inside Prescient, which I think is one of the largest. And these are engineers who are software engineers. I think there are a lot of other engineers at Prescient, but software engineers who are building technology. I think that is one of the largest technology teams in healthcare, definitely in India, if not the world. So I think there's a very, very strong focus on it. And then, my both co-founders are surgeons themselves. At the end of the day, we are healthcare. We can put any technology, but if a patient outcome is not there, we are not doing well. So the focus on both the aspects is very, very, very strong. So to give you an example, how technology and patient outcome is actually also married here. We have a very unique model where we go and operate in different hospitals. On a weekend, on a Saturday, 1,000 odd patients are going inside and outside an OT in 42 different cities, in 400 plus hospitals, with roughly almost 2,000 nursing and paramedical staff interacting and cutting open a patient, right? And how do you ensure that patient is safe? That is where technology comes in. We are able to map, hey, this is a 60-year-old on a blood thinning medicine suited for a surgery at this time, and this patient who is a 60-year-old but is absolutely healthy and can be taken to surgery today. How do you detect this information out of the system across 42 cities and across 400 plus surgeons on real-time basis? That is what technology helps you. That's where EMR comes in, because all the data goes inside the EMR, and then automatic information ciphers to point out patients who are not fit. We also work with a variety of hospitals, and not every hospital might be fit for every patient, patient disease. For example, an OT which is up to the mark for let's say an anorectal disease is not up to the mark for a knee replacement. How do you map that into the system and do it at scale? Again, technology, sort of comes in there. Next, how do you ensure that every doctor, in million plus patient consults, is handling the patient in exactly the same way which you want, and is explaining them the patient background, anatomy, care, recovery, treatment process? How do you do that? That's where your automatic, OPD tracker comes in, where a doctor has to follow a certain path before he can, finish the OPD. How do you ensure that 500 patients who are going to go insurance don't get their claims in 400 plus hospitals? Again, technology comes in, because we are able to track how many patients have received queries, how many patients insurances are potentially getting rejected, in how many cases there is a delay from the insurance companies and stuff. All of this happens through technology. So I think in our case, there's a beautiful marriage, tech and healthcare. And yes, we have to work on both the boundaries. When we work with a lot of hospitals, I think post-pandemic, there is a lot more awareness, and there's a lot more acceptance to new technologies. I'll tell you also something which a lot of people might not necessarily acknowledge. With Swiggy and Zomato and some of these grocery delivery startups coming in, the adoption of technology by the smallest restaurant or by a grocery shop has literally convinced a hospital owner, which is basically slightly more affluent businessman, to just get accepted. Hey, there is a technology which can help me, and you'll be surprised how much the success of these companies help a company such as Pristine when we go inside a hospital and when we have to talk to the owner and convince him to adopt our white label tech, which is going to help in patient care. Similarly, we are integrated with Uber and Ola to ensure that patient logistics from to and fro from the hospitals are on time. The biggest challenge, Chirag, we face is that we can be perfect, but the patients are used to coming late. They are not late to their airports. They are not late to their movie halls, but they're late to their doctor appointments in the expectation doctor is also late. And they're late to the hospitals because they expect the hospitals to be delayed. How do you solve that? And again, we use technology on multiple alerts, multiple at-home consents, a lot of report sharing, which is helping Pristine, help scale this business up.
Very, very interesting. I think especially the way other sectors are forcing healthcare to also adopt and evolve. Very interesting. I mean, talk a bit about. I think virtual scrubbing and theaters or surgeries are as acute as it can get, or as critical as it can get in a healthcare setting. Right? We're not talking about outpatient consult. What have been the challenges to get this adopted by clinicians, by nurses, by the entire staff of having and even consumer or patients for that matter, of having someone to do virtual scrubbing?
Yeah, it's a great question. I can speak to this both as a practicing surgeon. I've been a practicing surgeon for over 10 years, but also as someone who's kind of led intimately the development of the Proximie product. The first and biggest challenge is always culture. You're asking clinical teams to do things different from how they've been doing it for decades. You're now asking them to embrace new digital solutions, technology, video, audio capture, cloud-based solutions, where they were, only 5 years ago or even a year ago, are still writing on whiteboards, capturing things on pieces of paper, counting swabs item by item. So you're taking a very, very analog environment and trying to push it very quickly into an extremely digital environment. And so when you do that, first and foremost, there has to be a very seamless user experience. For a clinical team to say you have to go on three sessions of training and it's going to take lots of different clicks to get in, that process is not seamless. We are very overworked, understaffed, time is limited, and it's a very stressful environment. And so the actual user-centered design of the platform is essential. So with Proximie, it was very much about designed by doctors for doctors. This has to be 3 clicks and I'm in. It has to work with any device. You can't tell a hospital you now have to change all your hardware in the OR to something else because it's just not going to happen. So what you need to do is you need to back into existing infrastructure. And existing infrastructure is very heterogeneous. Some ORs are brand new, state of the art. Some were built 20, 30 years ago. Equipment can be out of date. All those things are important. And so we took a very software first cloud-based approach, and we made sure that we were hardware neutral and vendor neutral. So I could work on Android or iOS. I could work on Stryker, Storz, Arthrex. I could work on an intuitive system or an open system, a closed system or an interventional system. So we are able to span the need, and the value creation then can be much larger. So that's 1. 2 is the clinical teams have to see value at the end of it. If it's just a nice gadget, they might use it 3, 5, 10 times, but after that, they'll move on to something else. But if you're using a technology that's supporting patient safety, supporting patient quality, that's improving training and staff well-being, being able to bring the expertise to the room, having a second opinion, a mentor, a coach, a senior surgeon who can come and give that extra guidance and comfort to a local doctor. These are important. And finally, it has to be about systems efficiency. So what we did through Proximie is we focused on the quadruple aim. Through Proximie, you can look at operative room efficiency, setup time, turn down time, equipment used. How do you move the room quickly to get the next patient through? We looked at training and well-being. I can virtually scrub into the OR. And as we speak, there's a case in Hyderabad that they're testing some new technology and they're looking at coaching from overseas to help them work through that as we speak on new robotic technology. So that ability to sort of bring that interface is important. And then, of course, patient safety and quality. Ultimately, what you want from a patient perspective is you want to know that the best expertise, and I think Harsh spoke to it a bit, you want to know that the best doctor or the best surgical team is performing your procedure. And so by capturing audio, by capturing video, you can do that. And so our approach or go-to-market has been through the clinical teams with value creation and proposition throughout it, but recognizing that we have to take everyone on the journey. So we unlock value for clinical teams, we unlock value for hospitals and health systems, and we unlock value for device companies. And those are really the trifecta of the people around the operating room. And so far that has been successful. We work in the US, we're in over 500 hospitals. We work with all the big medical device companies. We do cases in India, in Australia, in Japan, in Europe, Africa, and we help across the socioeconomic landscape as well, from the most wealthiest and richest of hospitals in the world to the most dire and limited facilities in a small county hospital in Kenya supporting safe maternal obstetric care. And today, I think often technology siloed themselves as like, for that or for the other. And we've worked really hard to make sure that we can span all surgical care, all 330 million procedures that happen every year.
It's remarkable, Nadine. I think how much a technology can do, not only a better clinical quality, but just expand, make it affordable, accessible to so many millions of people. Maybe shifting gears, Vishal, I think I'd love to wear the other hat of an investor, right? I think we are in a country and an era where we're seeing a lot of new startups coming in. We're seeing a lot of disruption happening in healthcare. What do you look for in a founder? I mean, in a healthcare space, I mean, what gets you convinced that this is technology or this disruption is here to stay? And how do you look at the new upcoming startups and founders?
Yeah, very interesting question, Chirag. It's a very, very interesting question. I think the good thing is that the next wave of healthcare is actually a combination of engineering and medicine, right? So I think that's one big disruption that is already happening, that it's these two combined forces, which is really going to create the future of healthcare. So, when you start looking at companies, you fundamentally start first from the idea and the innovation. But more importantly, what I look behind every founder is not just the passion, but the ability to execute. There are tons and tons of founders out there who have great ideas, great innovative mindset, ability to think out of the box. And again, as I'm saying, that many of them come from an engineering background. So, their approach and their framework is top class, right? In terms of their thinking and their approach to their business model. But I think somewhere down the line, we've also seen that the execution side is the one that sort of makes or breaks these companies. The second one, which is more important and is going to increasingly become more important for all of us, is where is the path to sustainability? I think we've lived through an era of great capital available. We have lived through an era where there was cheap capital available. And we have also lived through an era where, one could sort of go through the entire curve of companies not being profitable for a long period of time and continuing to get funded multiple times over in the path to discovery of sustainability. I think we have come to an era now where that is going to change a lot. And therefore, what the new breed of founders have to also show is the tenacity to be able to ride that wave, which is to take their companies in an era where funding is not going to be that much of at the same pace and the ease with which it will come, right? With every funding round now, things are getting more and more difficult for everybody. I think that's going to be test number 2 in terms of the long-term tenacity. I think the third one, which frankly is very, very critical now, Chirag, is when do you let go of the idea that you are infatuated with? And how do you also begin to try and change course? Now, there are many who are changing course multiple times over in the path to really finding a way to sort of show that I am worth the capital that I have raised. And I think that in itself sometimes is not great. But how do you stick to the idea at the same time, continue to really push the boundaries, particularly on the cost side of things? Because we all live for gross margin and EBITDA. We live and die with our capital for these two metrics, right? And so therefore, from an investor perspective, I think everybody is going to be pushed to sort of prove their model a lot more. And one sort of creates that, that bandwidth of time to be not able to achieve it, because obviously there are going to be roadblocks on the way. Their growth is always an Excel sheet. And between what you see on an Excel sheet and what you see in a reality will always be very different. So you accommodate for that time, and you accommodate for the markets not giving you the benefit for that period of time. I think last one, as many of our, the discovery of exits, right now, the discovery of exits either to others or to public markets, as we've also seen that, some geographies of the world behave very differently than the others. The US market and the analysts in the UK and the analysts in the US particularly are very well versed and very well understandably intelligent enough to really model themselves on the back of loss-making companies for a lot period of time, but still their stock price movement does not accommodates for a lot more. I think we are seeing that in the Indian context, particularly, that window of opportunity is just not there. And so that is also going to throw a massive challenge in the front of all our founders, that how are they going to sort of live the life of a publicly listed company, which has gone on fairly early and where the P&L and the balance sheet are still very tricky, but you're still able to go and match the expectations of the market. So I think we are dealing with a host of issues which have sort of not been dealt with in the last decade and a half, where the funding of companies happen endlessly and with very high valuations on a consistent basis. We are going to live a very different reality of life. And that will throw up a very different set of new founders as a group of, and I think those companies will be phenomenally good companies. Those founders will be phenomenally good founders because they will be the next generation of business builders. So I think that's really what I look for today, given the complexities of the market that we are dealing with and the complexity of capital that is coming our way today. This is going to be a very complex journey for all of us together.
No, I think these are very interesting times. I think very well captured. I think a lot of budding founders in this call will actually find it very, very helpful. Harsh, I think you have been a serial entrepreneur, right? What were the mistakes which you avoided while setting up Pristine Care, and what would have done differently looking back?
When you were asking, Vishal, what does the future hold and what the exciting things, I was also grinning, where end to end. A lot of people come and tell me that you guys have built Pristine in a slightly faster period of time, and you achieved the unicorn status quickly. But let me tell you, and I know Vishal will agree with me, the unicorn doesn't exist. It's a very, very emotional word. So I would actually encourage all founders, friends, and colleagues, and everybody starting up, to don't look at that as more of a byproduct of whatever happens, and not necessarily go for it. I think we've been blinded by it a bit. But I think as an entrepreneur, Chirag, we need two qualities very, very strongly. One of them is we need to be super optimistic, about anything else in the world. And that just even in the times, and maybe I'm actually on the counter side of Vishal. I think these are even better times than they were last year, because there is more capital available, because there are lesser bad ideas who want to take it away. If Vishal has capital, then there were 10 people reaching out to him. Now there are only 4. So if I'm doing something really worthwhile, I think I stand a better chance. That's how I look at it. So I'm super optimistic of that. Second thing, I think as a quality, we all need to be ostriches in some aspect. We need to have, as entrepreneurs, we need to put our head in the ground, ignore every everything around us, and know our path and find our way. So I think those two qualities have served me really well, especially this time. But this is my 4th startup. Like you said, I started my first company in 2010. From 2010 to 2015, I started 3 of them, all failed. It's very, very hard to say why they failed. I thought I had a brilliant idea in each one of them, but like Vishal said, ideas don't matter. It's the execution. Definitely did not execute well. I think if you ask me what we changed here in Pristine this first time, frankly, I would say I don't know. I was as honest earlier as I was this time. But the only real difference was our business made sense day one. we were solving a problem day one. We were actually unit economic positive and EBITDA positive even day one. Of course, as we have grown, we've seen some numbers being shaken a bit, but we are still unit economic positive, and that's how Pristine was built even day one. But I think one thing which has stood out for me, which I will share with every founder I find it, is to really focus on building a really strong team. When I was building my earliest startups, me and my co-founder, and every startup had a co-founder, we were really the only folks who were in the aspect of were probably the smart people trying to think about ideas. Everybody else was just executing. And I would always try to find the cheapest person available, the lowest salary I had to pay, and hire that person. In hindsight, I think that's the biggest mistake, because as a founder, I can't go and solve every problem on the ground. But when you don't have smart people in your team, then you are going to have a lot of blind spots, which otherwise somebody else who would be smarter on the ground would have solved for you. So I think hire smart people. When we started Pristine, when we hired our first resource, we didn't have enough salary to pay to him, but I literally begged that person. I had to speak to his dad, and he said, "Sir, you have failed 3 startups. You have only worked for 2.5 years in your life. You are only 32-year-old. You have never built a company. What confidence should I have to allow my son to work with you, who's starting his career and he's just spent 3 years?" I had to beg him, and we didn't have an office. We were sitting in a clinic, which was a 10 by 10 room. And he said, "Hey, my son is an engineer from the top-notch engineering college in India. You are sitting in a clinic, which is a 10 by 10 room with 2 doctors and a failed entrepreneur. Why should I let my son work with you?" So, but we had to literally beg that person to join us. That person is still here and has made such a big difference. And I think that has gone on. I think the second thing, which I'll say, which is not very popular, as you might have realized this recently, Vishal hinted that I think there is a need to execute and need to work extremely hard, sometimes 18 hours a day, when you have extraordinary dreams. I know that's not a very popular opinion, but the context is fairly straightforward. If you are aiming to build a company, and aiming to disrupt an ecosystem, aiming to go against everything else, and you are going to somebody like a Vishal or every other ecosystem and asking for capital, they are not looking for 12% return. They would go to mutual fund for that. They are looking for extraordinary outcome. What that means is you have to grow fast, and you still have to build a large company. And if you have to do that, it will need extraordinary commitment. And I see that a big challenge. Just a few days ago, I had this founder reach out to me, the best college in India, the best startup you could imagine, super sharp guy. And I asked, and he said, "I am trying to raise capital." And I said, "Okay, amazing." I said, "What's been the progress?" He says, "I've thought about an idea. I've put a PPT, and me and my co-founder have quit our jobs, and that's what we're doing." I said, "Okay, what's the execution?" He says, "No, we are just trying to raise capital." I was like, "Okay, but what did you execute?" He says, "We want to raise capital and make mistakes fast." I said, "How much money have you earned in the last 6-7 years of your work life?" He says, "I have 1 crore rupee of saving." I was like, "That's phenomenal." I had 15 lakh rupees or 20 lakh rupees of saving when I started Pristine, and I would have, if Pristine would have failed, I would have been bankrupt for the 4th time in my life. And you are saying you're raising capital, not even risking, $2,000. Like, why do you want to be a startup? So I think that's something to be questioned. And as with Dr. Nadine and everybody else will tell you, I have literally, avoided divorce 3 times in my life as building Pristine. I mean, so building a company and building a company fast, which is valuable, raising external capital, you need commitment for that. And sometimes 18 hours also falls short. So.
Yep. Very, very good, interesting food for thought. Nadine, from your side, as a clinical entrepreneur, any advice for the budding clinical entrepreneurs?
Well, I mean, I think Harsh did a really good job at sort of summarizing the space, but just a couple of things I would say. One is you really need to make sure you always have to keep asking yourself that question about product market fit. Are you really solving a problem? Or is it a solution looking for a problem? And I know it's very cliche and everyone says it, but you have to consistently be asking yourself that question, and how is this going to scale? Because it's one thing taking something to a pilot or getting 5 or 10 people interested. It's another trying to get thousands to millions of people interested in it. And making sure that you're constantly reevaluating that in your product roadmap, in your development, in your value proposition, in your messaging, I think is really important. The second thing I would say is you have to surround yourself with smart people. I couldn't agree with that more. It's a big thing that I did from the beginning, is making sure that you know where your gaps are. No one is perfect at everything. You might be much more good at the vision, the strategy, the commercial. You might be more good at the technical or the financial. You have to surround yourself with the complementary individuals that are going to help you drive that business. So really focusing on team and culture in your company, being very delivery focused, being very, team focused, I think is important. And it's not easy. As your team company grows from 10 to 50, 50 to 150, 150 to 500, you have to keep reevaluating that, because the intimacy of a small company is very different when you're bigger. I'm sure, Harsh, you're not spending time with every single person in your company you just don't have the capacity to do that anymore. But you have to make sure that the culture, the vision, the values are consistent across the organization. So really investing time on that in the beginning, I think, is very important. The third, I think, is just real grit and tenacity, because it is tough. Healthcare is complex. We are trying to solve very complex, diverse health systems around the world, and we're trying to solve problems that are impacting individuals, even our own family members, our own relatives. These are challenges that we all see in healthcare every single day. And so it's emotional, it's divisive at times, it's complicated, it's bureaucratic, it's public and private sector, all those things. But there is a silver lining at the end of it, because at the end of the day, if you're succeeding, then you're touching lives and you're making that difference that is needed. And people are grateful to you for doing that. So you need real thick skin and grit, because you're going to get a lot of pushback, a lot of no's as you start your journey of disruption. And you have to be willing to, deal with that and kind of push through and be persistent. So those would be the most common things I would say. And the final thing I would say is it's very easy when you're starting to see a lot of momentum and a lot of people talking to you about all the great things they want to do with you, is to try to do everything, because every opportunity is interesting and every opportunity is exciting. But trying to keep your team really focused on 2 or 3 key, objectives, and being comfortable saying no to the other, saying, look, it's really great that you've come along. No for now, but we'd love to reconnect 6 months from now when we finish, but we're in the midst of an important product release, or we're in the midst of an important study, and we just don't want to distract our team from that. Because trying to go wide and thin doesn't get you the results you want. You end up just getting distracted, and you really need to focus on what are the metrics or what are the key milestones that you as a group need to hit to get to the next phase and the next phase and the next phase. And that mindset is sometimes difficult, because you want to help and work with everyone. There's great people that reach out to you, but sometimes you just have to say no.
Chiraag, if I may add another point, being in healthcare has a very, very special advantage, which probably no other industries, ecosystem has, which is when you're trying to build phenomenal young companies, the best or the easiest way to drive people is show them the impact of their work. Healthcare inherently, just by the basic nature of the ecosystem, creates that impact. Whatever you might do in healthcare, it will improve somebody's clinical outcomes, somebody's experience in a hospital, somebody's experience with a doctor, somebody's experience with the recovery or mental health, something which becomes positive. I mean, you can do whatever in the world. At the end of the day, if you're doing Uber or logistics, you are helping somebody go from A to B. But if you're doing anything in healthcare, you are improving somebody's mental state, physical state, family's mental state, something. So that natural ecosystem which we have, which is impact, healthcare is inherent a positive impact, and that has helped us drive a lot of our young people. Like you mentioned, culture is so important. If you can show people impact, and healthcare has inherent nature of it, which is very advantageous.
No, absolutely. Could not agree more. Maybe at that time, I think at this point of time, taking a pause and looking at there are a bunch of questions which have come. I'll try to club some of them together and do a quick round of it. So I think this question, maybe I'll start with you, Vishal. I think there are a bunch of things happening from the government side. There's NDHM coming. How do you see some of what are the new models or business disruptions emerging, or new ideas which can come because of NDHM?
Yeah, so I think NDHM is a great move, Chirag, and I think all of this rides on the fact that there are going to be more than 900 and odd million people in this country who will have access to internet connectivity, right? And I think a lot of our hypothesis of the future is built around that group of consumers. So with NDHM, you probably are going to see a lot more interoperability of medical records. I think EMR, as Harsh also said, is going to be omnipresent, and I do hope that that this entire National Digital Health Mission basically pushes that one agenda forward. Because if you're going to get that right, you are going to get a lot of other things right. The second one, which I think, with the entire availability of data, and which the NDHM will obviously have a lot of access to, particularly from the India context, the fact that we have very little disease surveillance, I think a lot of that can change. So a lot of that can also be massively impacted in terms of the future models that you create, which I think, frankly, Chirag, I see more and more orientation towards specialties and diseases. And not just random throw of healthcare around, but starting from prevention and wellness to basically more impactful models of care for different diseases and different specialties is something that the NDHM can actually help create a lot more because of their ability to create oversight on what is happening around the country.
Harsh, what are 2 or 3 most interesting startups you're excited about in this space?
Oh, I think, there is...
Beyond pristine, by the way. That is a disclaimer.
No, yeah, of course. No, I think, the surprising part is there was this huge study which was done where they picked, some amazing university picked the most intelligent analysts of the time and asked them to predict the future. And then they asked a bunch of monkeys to throw darts, and I think the monkeys performed better. So I don't know, sir. I can tell you whatever shit, but I don't know the way the work functions. I can tell you what I'm excited about. I think just as an optimist and somebody who's excited by technology, I see so many developments around which gives me a kick, right? Variables. I think today I don't stay with my mom and dad. My mom and dad stay in our hometown. I get constantly worried about their well-being, right? Their aging. I think there's going to be, it's already there. In fact, we are working on it as well, where I can easily monitor their blood pressure, their sugar levels, their heartbeats, their temperatures, all their vitals, all by myself, by having a simple wearable watch, a simple wearable ring, even having a patch under their pillow. Like that's going to happen, right? So super excited by that. I think even 3D printing. I don't know if you guys have spent time on it, but 3D printing is going to change the way we design and use artificial limbs. It's going to I think fundamentally bring that industry, and it's a niche, right? It doesn't impact everyone. But the point is that it has for almost like 30 years that has been lingering in the background. 3D printing is going to change it massively. The other thing which we get super excited, which we touched the chord earlier, which I think Dr. Dean is already working on, is I think the physician training. It's surprising when India has a lot of doctors. I think by some standards, even though there is this doctor-patient ratio we talked about, which is skewed, but the fact of the matter is that every year India produces 200,000 surgeons, right? And out of our medical graduate schools. But the number of them who are trained on a simple new age laparoscopic surgery or a new age laser procedures that numbers is limited. And I think our healthcare colleges will take a time before they're modernized. But modern teaching methods, borderless OTs, scrubbing in a virtual OT, that's going to change the way doctors are going to be trained, not just in India, but I think, globally that's going to change like a lot. And then there are those physical things, right? Then there are those simple things of efficiency in insurance, in patients, in doctors.
Yeah, maybe Nadine, just in interest of time, one startup from your side which you're very excited about, or one big idea, and then we'll try to wrap up.
Just really quickly, I mean, the areas I'm really interested in are, there's a couple of companies looking at this ambulatory remote care, like how do you sort of decentralize care back into the communities? That's really interesting because even as I think about Proximie, we want to really start to span across the surgical care continuum from pre-op, intra-op, and post-op. And so how do you start to connect the data sets and the care delivered around the fringes as well when patients, before they come to hospital and after they leave the hospital? And I think that's going to really help keep patients out of hospital or discharge them quickly after surgical care and work through that. So that's really interesting to me.
Super. No, I think thank you so much. And this was a very, very rich discussion. I think if I have to summarize, I think healthcare is here to grow. We are really at India at 4% of GDP is healthcare. Globally, the number would be even lesser. It is going to grow as economies grow. Patient is the consumer and consumer is the king. I think fact is that consumers are accessing Amazons and Ubers of the world. They are getting more demanding. And in reality, what I'm taking away, tech can create a win-win-win, right? For the doctors, for patients, for systems, from outcomes, experience, convenience, cost. It is a win-win solution. And again, very quickly, 10 things I picked up on what does it take to be a successful startup. Just trying to enumerate all that. Ability to execute, tenacity, ability to repivot, being optimistic, very important. Having a strong team, not be a Superman on everything, getting the right unit economics. It takes effort. There is no shortcut. It takes effort. If you have to go all in. Right culture, right vision, having the resilience to see through the cycles, having the focus, not getting distracted, and very important, creating the impact and inspiration using the impact, right? But I think, thank you everyone. I think it's a fantastic session for a lot of budding founders and people in the space. Look forward to continue this conversation offline. Thank you.